Thank you. So welcome to the May 9th, 2022 meeting for CB11's Human Services Committee. My name is Isaac Scott and I am the chair of the committee. This meeting is called to order at 6:06 p.m. Tonight we are joined by Community Associate Marlene Pierre, the staff liaison to our committee. To conduct an efficient meeting, let's observe a few ground rules. First, no one may speak until the floor is granted. Next is CB11 members. If you have a question about board business or if you wish to make a motion, please raise your hand through the Zoom. And I seen someone did that already, so thank you very much for that. If you click the participation icon, the participants panel should appear and you should find the raise hand function there. If you still have technical difficulty or you can't find it or anything like that, you may click the chat icon and relay your difficulty to the staff. And I know that Marlene and myself will be watching the chat, so you should be good on that. The chat function should not be used for CB11 business or questions about agenda topics. All such remarks should be made on the record by raising your hand through Zoom. Chat should only be used to alert us of any technical difficulties you are having or to state in writing information like your contact information that was already stated out loud. So as much as you can, please state it out loud on the record because it is recorded. When a member is given the floor to speak, I will identify you and you can unmute yourself so that you can speak. Please keep your questions and comments succinct and germane to the discussion. Members of the public, if you have a question or comment about the subjects on the agenda, please raise your hand through Zoom and wait to be recognized. And finally, this was a ground rule I just added in today. Be patient with me. This is my first meeting chairing this committee. So if I am reading off the script and doing different things that may annoy you, please be patient with me as I get acclimated with this position. I promise I'll flow with this a lot more better as I get more comfortable with it. So having said all that, Marlene, I think we're ready to do the roll call.
Sure. Eva Chan. Eva Chan is out today. Oh, Sandy Garcia. Robin Krinsky.
Present.
Thank you. Patricia Martin.
Here.
Thank you. Jennifer Meyer is excused. Shirley Pena. Arturo Perez.
Here.
Thank you. Pastor Isaac Scott.
I am here.
Thank you. And Robin Stration.
I'm here.
Thank you. We have a quorum.
Thank you very, very much. Okay. Next, we will move to adopt the agenda. The agenda for tonight's meeting was distributed ahead of time. This question was just asked in the chat by the board. Oh no, this was asked about the minutes. Excuse me, I'll get there too. The agenda for tonight was distributed ahead of time by the board office and was posted online. If there is no objections or are no objections, we will adopt the agenda as stated. Committee members, if you have any objections, you may raise your hand through the Zoom. See none. Okay, so we will adopt the agenda. I will move on to adopt the April committee minutes. The minutes from our last meeting were also distributed to committee members ahead of time by the board office. If there is no objection, we will adopt the minutes from that meeting, April's meeting. Committee members, if you have any objections to the adoption of the minutes, please raise your hand. Seeing there are no objections, the meetings from the last committee meeting are adopted. They will soon be available on the CB11 website. So we will move on next to our announcements. I do not have any announcements for this moment. I will ask board members, if you have any announcements, please raise your hand so we can recognize you to get those announcements on the record. Any announcements from any board members? I see Robin Stracham.
Thank you, Isaac. Let me lower my hand. Lower hand.
You're good.
Sorry, too much technical stuff. My colleague Joseph Di Benedetto is our advocacy representative at Search and Care, and he is very involved in a motion in the state called Fair Pay for Home Care. And he's doing a workshop on it if anybody's interested. It is May 24th from 9:30 to 10:30. If you're interested, just contact me. I'll put my email in the chat and we'll send you the Zoom link. Thank you so much.
Thank you, Robin. Yes, please leave that information in the chat.
Mhm.
Thank you so much. Any other board members have any announcements for now? Okay, seeing there are no board members who wish to share any announcements, I will ask if there are any community members who wish to share any announcements with the board at this moment. Please raise your hand so that I can recognize you. Okay. Seeing there are no announcements from I take late hands too, so if you're fumbling trying to get your hand raised, it's okay, just raise it, I'll come back to you. Okay, cool. Okay, so I'm gonna move this along so we can move on over to the informational updates. Okay. So first we're gonna have our informational updates. We have Pauline Ferrante from the New York Department of Health and Mental Hygiene to give us some COVID virus updates. Do we have? Is Pauline?
Hi, good evening. Can you
Hey,
hear me?
how are you?
Okay, great.
Yes.
So you're doing a great job leading your first meeting. So as everyone knows, I'm sure, or hopefully if you don't know, I'm sharing new information with you. But as of last week, New York City is now in COVID-19 alert level medium, which just means that there is a moderate community transmission, but we really want New Yorkers to remain vigilant. So it's strongly recommended that you stay up to date with your vaccines. So if you haven't been vaccinated, please go ahead and get vaccinated. And if you're eligible for your booster shots, please do that. We also recommend very strongly to continue wearing your face coverings in any public indoor setting, especially if you don't know the vaccination status of those around you. We are asking people to get tested if you have symptoms, were exposed or traveled, or were at a large event. Obviously, if you can, stay home if you are sick. And if you are unvaccinated, again, you are at a much higher risk for severe COVID-19 illness. So we just want to make sure people continue to remain vigilant and to get vaccinated if you haven't done so already. And I know that there are a couple of points about masks that people have, the federal government did lift some of the masks mandates, but New York State is still being pretty stringent about masks. So we want people to understand that masks are still required in public transportation, including subways, trains, buses, ferries, taxis, and other for-hire vehicles, including Uber and Lyft. I know that Uber and Lyft in other jurisdictions do not require masking anymore, but again, in New York City and New York State, that is still required. Masks are still required in JFK and LaGuardia and other New York State airports. So even though the Port Authority for New York and New Jersey manage the airports in JFK and LaGuardia, you're still required to wear face coverings, and in New York, you're not. So again, I know there's a lot of confusion out there, so just want to make that super clear. Masks are still required in healthcare and other congregate settings, and masks are still required in child care centers that are run by the city, especially for those children under the age of 5, because they're not yet eligible to receive the vaccine. So just to reiterate where masks are optional. Masks are optional for K-12 schools for students and staff, and businesses may choose to leave their mask requirements in place. So Key to NYC no longer is in place, but some businesses may choose to have their patrons continue wearing face coverings indoors. So I hope that clarifies some of the masks mandates around. And then I just want to give a update about second booster shots. So if you're over the age of 50, or if you are 12 plus and immunocompromised, you are eligible for a second booster. So we encourage anyone who is eligible for a second booster to go ahead and get that as well, since we are seeing a rise in community spread, particularly in Manhattan. So we just want to make sure that everyone who's eligible understands that they are. And also, so if you do test positive and you get your healthcare professional to diagnose you with COVID-19, the city partners with Alto Pharmacy, where they can send you antivirals that are specifically for COVID-19 directly to your home. So again, I think it's really important that people understand that testing while testing at home may be helpful just for you to know sort of your status. If you want to get antiviral medication, you will need to get a diagnosis from a licensed healthcare professional, and they will determine whether or not that medication is necessary for your particular case. And if it is, you can have that medication delivered directly to your home. So those are the biggest updates with regards to COVID-19. So I'm happy to take any questions people may have related or unrelated to COVID-19. Thanks.
Thank you so much, Pauline. Thank you for touching on the second booster shot. I did have a question, and you may or may not have the answer to this, but just wondering, how much higher does the risk level have to get before that second booster shot will be recommended for sort of everyone?
Oh, so you mean when they lift the restrictions where the second booster is then available? I don't know that for sure. And I don't know necessarily whether or not it's, based on a higher risk of community spread, but I am happy to go back and ask our team if they have a better understanding of when the second booster will be more readily available to the general public.
Cool. Thank you very, very much. I appreciate you. I want to open up the floor for any board members who may have any questions. If you raise your hand, I'll recognize you. Seeing no questions from any board members, do we have any questions from the general public? You did a great presentation, no questions? It's the first time I've seen that. Okay, great. Thank you very, very much again for coming and blessing us with this information. It's very helpful, and I thank you again.
No problem. Thank you so much.
Okay, so I'm going to transition us now over to our next update, which is from Health and Hospitals, from New York City Health and Hospitals. I think we have Noel Alicia. Did I say that correctly?
Hi, Pastor Scott. I don't see Noel Alicia on the line today.
Okay, great. Thank you, Marlene, for that. So I'm going to, if this is cool, I'm going to move us forward into our business session. And first on the agenda for our business session, in the presentation and discussion session, we have an informational discussion regarding the mayor's preliminary budget for fiscal year 23. CB11 received the mayor's response to the preliminary budget for fiscal year 23 during February 2022. The Human Services Committee created 14 budget requests pertaining to seniors, mental health, COVID-19, healthcare, and substance misuse. One budget request was funded. for fiscal year 23. And Marlene, could we show those? Could we transition? And I just want to take a few seconds to allow committee members. We have Jose Mercado from the New York City Department of the Aging, excuse me. We have him here with us to answer some questions, but I wanted to put some information up on the screen for folks so that everyone was on the same page. I'm not sure if everyone has had the opportunity to review the budget or know what items we requested, or what requests we made rather, and what was funded and what was not funded. So I humbly asked Marlene, I added some more work on plate, and asked her to add these to the slides for you to review very briefly so that we are all on the same page. One of the things that I want to ensure as we move forward as a committee is that we are all on the same page. And I know folks come from long days, we have a lot going on, and we may not, we may have looked this over, but 50 things happen between that time and this meeting. So I want to ensure that we all, sort of on the same page with what we are looking at, what information we're voting on, and all of that good stuff, so that we are informed, right? We want to make the most informed sort of decisions, votes, and ask some informed questions, because this is important. So having said all that, I want to open the floor to Jose Mercado, budget liaison with the New York City Department of the Aging. Jose, thank you for your patience. Sitting with us, you were on the call really early with me. I appreciate you.
Sure, no problem. So my name is Jose Mercado with the Department for the Aging. I'm the Chief Financial Officer for Department for the Aging. So basically, I was asked to come here and give you kind of an overview of the community board's request to the mayor's budget. So right now, for example, I'm going to basically kind of put things in a couple of buckets, so you can kind of put them together, so you'll know exactly, because some of these requests are kind of repeating itself. So currently, there are some good news. Some good news is, for example, in the executive budget, the mayor basically has proposed additional funding for case management, roughly about $6 million. Now, that is basically $6 million that will be covered citywide, right? So that is not specifically for this community board, but it is a $6 million request citywide. How that money will be allocated will be determined between now and July 1st. So we're starting to look at where the needs are regarding case management. Now, case management is a service that basically our seniors, anyone above 60 years old, can go to seek additional services. Case management does reviews. They'll determine whether a client needs home delivered meals, whether they need home care. So that's kind of the door that opens up for services. So that's kind of puts everything in kind of, I would say, the case management world. Home care, we actually are currently going through a current RFP. There is no additional funding, but we are going through a current RFP, which is also a citywide contracts, but also they're very specific to the specific boroughs as well. So right now the RFP actually ends tomorrow. So people can submit their proposals. So that basically ends tomorrow. Then they will be reviewed and new contracts will be coming out. Regarding, I would say, home delivered meals, there's additional money for home delivered meals in the mayor's budget. That also is a roughly additional, I would believe it's about $8 million additional, which serves roughly about an additional 3,000 clients. That is also basically we'll be determining where those fundings will go to based on the assessments that are done. Now, as I don't know if everyone's aware, there is a Get Food Transition. Get Food Transition was those meals that were provided to anyone who basically needed meals during the pandemic. So we're basically looking at, because that transition actually ends in June 30th, we'll be determining where those 3,000 additional, I would say, additional units or clients will be put into those different contracts as we get closer to June 30th. So maybe throughout the whole city where this additional money is allocated. So it's not something specifically for this current community, but you may see more funding, but not 100% sure. We won't know that until June 30th. So kind of those are the three different buckets that we're discussing. Now, the last item, there was additional funding for the senior centers. There was just a senior center RFP that was actually concluded in December. We have brand new contracts that affect the December 1st that go through 3 years from now. So there are additional services citywide. Now, regarding if there are specific needs in the community, it's up to the senior center to actually identify what needs are within the community and serve them. So I know I went through each one of them, but I put them in different buckets. So I don't know if there's any specific questions anyone want to have.
Thank you, Jose. I appreciate you going through that and for coming up to speak with us about this. You know, we've been asking folks to come before us and you know, give account for why requests weren't granted, and so we appreciate you being here. I want to open up the floor to any board members who may have any questions for Mr. Mercado. Yes, Robin Stration.
Hi, good evening, Mr. Mercado.
It's Mercado. Sorry.
Mercado, I'm sorry.
It's okay.
Sorry.
I work for a social service agency that's privately held, and we specialize in in-home services. And many of these requests that we've made to the Department of Aging, I've been involved with because I know that we need more ISIP home care hours. ISIP, for those who don't know, it's the home care program for people who are not on Medicaid. And there are many seniors who do not qualify for Medicaid, yet they need home care, and it's more costly to them. But yet ISIP is the one way they can get it that makes a lot of sense to many of them. And I don't know what other way we can increase those hours. We continue to ask you for it. Yeah, I think that you understand the need, but where does the additional money, where can the additional money come from, I guess is my question.
Right. So as part of this, you know, the funding for these programs combination of city and state. And so part of this, for example, we did request as part of the state budget to add additional funding. And basically there was funding granted, roughly about $5 million extra, and we're still waiting for that. So once the state appropriates their additional money, we'll know exactly, you know, where, how we will then adjust the contracts going forward. So we know there was an increase in the state funding of about $5 million, but we're still waiting for that appropriation to be distributed to us.
I have another question. Do you have any idea how many seniors are participating in senior centers versus those who cannot and need services?
Well, I would say, for example, because of the pandemic, I mean, right now we know that our senior services are basically, a lot of seniors are not coming to the senior centers, right? Because of COVID. And so there's a lot of virtual trainings, a lot of virtual programming that we're doing. We do have, for example, seniors coming in for grab and go meals. Again, because seniors basically, a lot of them provide is a lot of congregate meals. That is like the main function besides other programming. So right now we do know that we're not at full capacity in terms of the congregate meals or the grab and go meals. So we have a lot of seniors who are still out there. We do know, for example, that the virtual training or programming is very, let me use the wrong word, but it's a very hot topic. And a lot of seniors are really into it and they want more of it. And so a lot of that we're trying to do. We've also been trying to distribute more. Like this year, we were able to distribute 10,000 tablets across citywide.
That's
so
awesome.
Right. So citywide, we were able to distribute 10,000 tablets. And so we have a lot of seniors now who are actually being able to kind of get onto the virtual programming that is happening. So that is happening, something that, like I said, we were very fortunate to do this year. We're trying to hope that next year we can look for more funding. But again, I can do is provide you with what we have currently for 2021 in terms of the services. I'll get that number for you guys and send it to you.
I just want to give you a couple of examples of why home care is so important to a person who is facing any kind of mobility limitation. Going to a doctor's appointment, I'm sure you'd agree, is really important to make sure that healthcare is kept up so that person has a quality of life despite any mobility impairments. But very often people with mobility issues need help getting to and from appointments. Not everybody uses Access-a-Ride. Not everybody can make it downstairs unaccompanied to Access-a-Ride. So they look to agencies like mine and to DeRote for escort assistance. And we're only in certain neighborhoods in the city. We're not everywhere. So very often we're looking at people who really need home care in order to have a quality of life. And that's why we continue to ask for expanded ISEP hours. And if you can be our partner in this, East Harlem is a community that is sorely in need. We have wonderful senior centers. and they provide wonderful in-person services. But as you know, the social service they provide is case assistance. And that's care management is so very important as people become more homebound. And it's wonderful to see that $6 million has been added to the budget. Kudos to you for doing that. I can see that it $8 million and it adds another 3,000 clients to Meals on Wheels. I see that these monies don't go really very, very, very far. So I understand that they're all precious, but we really appreciate your help in ensuring that our residents really have access to the essentials that they need in order to stay in the city, in order to stay in their beloved homes and community. It's much, much cheaper to do that than have everybody going into nursing homes, which frankly, nobody wants to do anyway. So we thank you.
No, I think,
We just like to see more yeses that you agree with this request. You've asked for the money and you got it.
Yeah, so we were very fortunate. I think, for example, to your point, I think the commissioner, our commissioner for next fiscal year 23, there is an opportunity. She will be focusing more on home care. She realized that right now we will only be able to do case management and home delivered meals. So she is interested in next year for FY23 to look at home care. Because again, like you mentioned, there are many seniors who do need additional services, do not qualify for Medicaid. But so that is something you will see the commissioner pushing more for that.
Great, because our requests are littered with this. Thank you.
Thank you.
Thank you, Mr. Mercado. Are there any more questions from our board members? If there are none, I will entertain questions from the community. Are there any community members on the line who would like to ask any questions to Mr. Mercado? Okay. Seeing that there are none, I will say thank you for coming again. I will say, as I'm getting acclimated to a lot of the city government aspects of what's going on, I'm going to be reviewing a lot of the information that's coming. It's a lot coming at one time, and we're, just coming out of, or we're at this phase of the budget. So I'm saying all that to say that you will hear from me again, and questions that I might not have asked today, I will get back to you on as I look more thoroughly into to all of the information that's before me.
Yeah, no problem. Like I said, anytime you guys want us to come, we'll be happy to come to the community board and talk and give you any questions you may have and answer them. So thank you for having me, and I enjoy the rest of the day. And thank you. Bye.
Thank you very, very much. You have a good evening.
You too. Thank you.
I just wanted to also note for everybody, if you see me looking on both screens, I have a monitor here and my computer here. So you are actually on this monitor. So I'm looking this way, I'm looking at you. So I just wanted to let you all know that, so you don't think that I'm like looking away, dazing off while we're meeting. Okay, so I want to, we invited the Department of Health and Mental Hygiene also to join us this month. They were not able to join us, but did send over some information. I won't attempt to pronounce the representative's name, as I will not go on the record fumbling over their name because it is a very difficult name, but they very humbly responded to our request to explain why certain requests weren't funded. They did send over their testimony delivered to the council at the preliminary budget hearing, and they sent over the transcript of that hearing. That can be shared with board members. And well, how far can that be shared, Marlene? I don't know if it's already public, or I don't want to get ahead of myself and say we share that with everybody.
I mean, to answer your question, it's a public hearing, but we could send it to the board members via email. It's fine.
Okay, great. So I'll ensure that you all have this information as well, so you can see what their responses were and what their testimony was. But in, yes, is somebody about to jump in? Okay, give me a second. Give me 1 second. I want to also note that in their message, they also referenced an initiative, Public Health Corps. I'm not sure if this was referenced at this committee already, but I'll just mention a little bit about what it is, and we can look deeper into it and go a little deeper at next meetings. But Public Health Corps is a program designed to employ and deploy trusted social services needs. So through the Public Health Corps, more than 500 community, it is designed to deploy trusted community members to better link New Yorkers to clinical, public health, and social service needs. So really just creating those people who can link folks directly with the needs and services that they particularly need. And through this Public Health Corps, more than already 500 community health workers have begun leveraging existing relationships with houses of worships, so those are churches, local businesses, and community groups to build a network committed to creating a healthier neighborhood. This is very, very important. I wanted to mention it because this is exactly, these are the exact sort of programs and initiatives that we want to see in East Harlem, those that link people directly to the social services that they need, those links that are tailored to people, because not everyone has a blanketed, we can't blanket issues, right? Everyone who may be of a certain demographic doesn't always suffer from the same sort of needs, or doesn't have the same needs or insufficiencies. So it's important that folks can be, partners right with the people that they need to be with, but also that this is not just a burden on, we're not just looking to city and government to, fill this need of helping us to ensure quality health and human services, but that there's also faith communities being held accountable, right? Also local businesses being held accountable and being brought in, and different community groups, being brought in to create a network of people that will be committed to the same mission of providing quality health services for folks. So I just want to note that, because these are some of the things that I want us to focus on a lot, and how we can support initiatives like this if we see them happening in different places, different ways. So I'll stop there. I won't take any questions on that because I don't have any, I can't answer any questions on behalf of them, but I will share this email with this information for folks. And you are more than welcome to look this up, Public Health Corps. This is an initiative of the Department of Health and Mental Hygiene, and I'm definitely going to reach out to them to speak to us specifically about this program, because it's important that we have some folks from this community board directly working with them, and not just working with them, advising them and how to tailor this sort of program to an East Harlem community, because it's different. East Harlem is not the same as Central Harlem or Morningside Heights. So it's important that, they're able to tailor, the work that they're doing for East Harlem. So with all that, I'll transition into our informational presentation. And this is regarding the shelter program at Volunteers for America, Greater New York. And we have Jonathan Tavares with us. So Volunteers of Greater America is an anti-poverty organization. VOA provides, that's their acronym, VOA. They provide services to families in need of emergency shelters, transitional housing, and permanent supportive housing. Our vice chair, Art, now sits on their community advisory board. This was a request that this committee made of them when they came before us to renew their lease with the Department of Health. So we requested that someone from East Harlem or from our committee be added to their community advisory board. And they have honored that request, and Art now sits on that board, our vice chair. And also we asked them to come before us to give us updates. So they are here before us today to give us an update on VOA. So Jonathan, I will turn it over to you.
Hey, hello everyone. Good evening. First and foremost, let me say, Pastor Isaac, you're doing a great job for your first time. Keep it up. Yes, thank you. Volunteers of America. So yeah, so we also services not just families, single adults. We'll go into it more. We do have a PowerPoint that we did want to share. I'm not sure who would have access. Is anyone on the board have access, or can we pull it up on our side?
You pull it up on your end.
Okay, Janae, would you want to share the PowerPoint if you have it? Or unmute.
Hold on, let me pull it up because I'm on the phone.
Okay, all right. Give me 1 second. I could pull it up. Sorry.
I mean, you all let me know if you need assistance. I mean, we have it. We asked for it in advance, just in case there are any technical difficulties.
Okay, gotcha. I got it. I should be able to pull it up. I thought. Just give me a second.
And this is probably a bad time right now to mention this, but I do want to acknowledge that I haven't been mentioning the times we've been allotting to presentations. So I just want to let you know you do have 15 minutes.
Yes.
You take 10 of those minutes for your presentation, but please allot at least 5 minutes for board members or the public to ask any questions.
Great, no problem.
Appreciate you.
Okay. So let me see if I could share it now. Okay, here we go. Please let me know if you guys can see my screen.
We see that it says that
It's loading.
Yes, that's what it's.
It's loading? Okay.
Yeah, okay.
Good.
Yes.
We good?
Yes, we're good.
Okay. Yeah, so we just want to give you brief information on our programs, myself and Janae. So I'm the program director of Community Support Services, right, which is a mental health program with single adults for men. And then Ms. Janae, she's the program director of Schwartz Assessment Shelter. So we operate in the same facility, right? So we'll just get right into it. I'll pass the floor to Janae.
Yes. Hello. Good evening, everyone. My name is Janae Mackey. I'm the program director of Schwartz Assessment Shelter. So I'm gonna keep it kind of quick. So just to start off, VOA has been around for over 125 years. We are a faith-based organization, and we were funded by volunteers who actually work with the homeless population. And we now have over thousands of professionals that work with that homeless population. However, for Schwartz, we deal with the single male adults. So VOA has other program types of shelters, such as family shelters, DV shelters. They have veterans, SROs. We even have schools for early education. On to the next slide, our CEO, Ms. Myung Lee. This is our mission statement, which we definitely stand firm by. Again, we are a faith-based organization, and we are dedicated to helping individuals and families in need to create positive and lasting change through social service programs that support and empowers all of our clients. We also have an addition to our mission statement that VOA is an anti-poverty organization, and we are working towards ending homelessness by the year of 2050. So that is our goal. To the next slide. So again, we have other programs, like I said, families, DV, domestic violence, SROs. We have senior homes. We work with individuals with HIV or AIDS. However, at Schwartz, again, we only deal with the men population, adult males, 18 years of age and older. We generally have general pop, employment. We do have mental health, substance abuse, sex offenders, parole, probation, supervised release. At Swartz, we have a bed census of 270. We have a dormitory style. We have 4 dorms. And we provide breakfast, lunch, and dinner for all our clients. To the next slide. So again, we are only an assessment shelter. So meaning that the clients are referred from 30th Street. When they arrive to Swartz, they do meet the social service department where they are assessed and they are categorized depending on their needs, on their case, if they're, general population, mental health, or substance abuse. Once they meet the social service department, we do have a housing department where they are screened before being assigned to their program shelters. If housing can intervene by any way, we can find housing for clients. So we do have some clients who come in with a subsidy or vouchers, or they have income where they can rent a room or get their own place. Housing even assist clients in starting a supportive housing application or finding permanent housing through supportive housing. They also do veteran placement, adult care home placement, detox, and treatment programs as well. We also have a service that assists clients with education and employment. We have a department called the KEEP department. Thank you. So the KEEP department is really like an extra support for our clients, especially when it comes to education and employment. They reach out to the community and gather linkages and bring them back to the facility. So we have like a podiatry service that comes weekly. We have weekly group sessions. We have community outreach that come and assist with like resume writing, building, vocational training. We work with Ready, Willing, and Able, the DOE Fund, to assist clients with employment, any trainings that they need, taking any civil exams. We assist with providing free cell phones for clients who don't have any phones, haircuts. We even started a new program. We have a barbershop program that's teaching clients how to cut hair, the health and safety of cutting hair, and other clients participate as well. So again, we are an assessment shelter, meaning the clients can stay at Swartz up to 21 days until we can find the appropriate shelter program for them when a bed is available. So depending on the timing, sometimes it could be less than 21 days. Depending on the case, some clients do stay a little bit longer. As you know, sometimes it could be a little difficult with mental health beds. So sometimes those clients do tend to stick around a little longer. It may be more than 30 days. But the lasting solution, we also provide continuous care with checking on clients, especially when they do move out for independent living. Once they are placed in their program shelters, normally the case manager, housing specialist, they kind of pick up from there and move on with that client. Comes to housing placement. So even though we are an assessment, definitely housing can intervene. We do have a target of at least placing 14 clients out a month. So we normally hit our target every month. We did have a slow peak during the COVID outbreak. It was very slow, but we still maintain move outs each month. Right now, we are dealing with a spike in COVID. Unfortunately, our program is on pause, meaning we are not accepting any new clients. We are not assigning clients to any program shelters because we had over 15 positive cases, and we also sent out over 30 clients who may have been exposed. So we are keeping a close eye with COVID right now, monitoring everybody's, symptoms if they may have any. DHS has been very helpful with providing on-site testing. We have on-site vaccination, on-site booster shots events. We also have the self-testing kits that they provided to us. We have tons of those. We also have a medical team it's not on site, it's in the next building. They also help us with testing, and they now have COVID treatment prior to the clients going to isolation.
Thank you, Janae. I'll take over from here quick. So see, as Janae explained, Schwartz has 270 clients, right, in the program. We share the same facility. So we have 65 clients in our program. So in total, the facilities host 335. We have 335 beds, right? Dormitory style, most of our clients are in dorm 2, on one dorm. So just briefly, I had a link here, it didn't work. So can everybody see the screen still? So just a little fact sheet on CSS. So we are an on-site rehabilitation program, right? So we assist clients with mental health, on getting them, helping them secure services out in the community, just to help them become more independent, and get into transitional housing, and eventually, get their independence. Just so some services that we do offer: support groups, educational job training. We do medication supervision, assistance towards 2010E application. So one of our main housing goals with our clients is supportive housing. That way our clients do have that support, so we don't set them up for failure, right? So I just wanted to briefly have that fact sheet here, but I'll go back to the slide. Sorry. So again, we are a small team, CSS. So, our social service staff just consists of myself, the program director, assistant program director. We got 3 case managers and 1 licensed social worker, right? Working with the 65 clients. Currently, we are looking for a case manager and a social worker, right? So spread the news. We're taking resumes. So, just like Janae shared, we do have a housing target, right? Which we are kind of overachieving right now. So we have met our placement goals for the fiscal year, right? We do need to place at least 27 clients for the fiscal year into housing. Sorry. Right. And right now, we're at 34 out of 27, so we're, our staff is doing a pretty good job despite, COVID and, what it's caused for us in our programs and the problems that it's caused, like Janae spoke about, the little spike that we're dealing with now, in shelter. So, right now, we're trying our best to service the clients the best way we can, but at the same time, making sure that everyone takes care of themselves and, stay safe and healthy. Yeah. So this is our contact information, right? So if anyone wants to get in contact with us, thank you Art, for attending the community board meeting. You know, last time, we do have it upcoming in June. We had to reschedule this month again, but due to the spike and what we're dealing with now, so, you know, we will reschedule that meeting for next month. We would like more information if possible. We would like to extend our invitation to more, you know, resources in the community. We are looking for contacts for the parole and probation, if that can be shared. You know, maybe someone, health and hospitals would be nice too, you know, to attend. So what, you know, information, we're open to taking information so we can extend our, you know, invitation to other community partners. Any questions?
Thank you very much, Jonathan. Thank you, Janae.
No problem.
No problem.
You said something that I wanted to jump right on and ask a question, but before I do that, I wanted to, Art, I don't want to put you on the spot, but I do want to offer you the opportunity to share any information about VOA that you may think the board should know before we get into any questions.
Yeah, sure. Thanks, Pastor Scott. Like Jonathan mentioned, there was no board meeting this past month, but I did present on the last board meeting that I attended with volunteers. I don't have any new information right now, but look forward to the next board meeting in June.
Thank you.
Got it.
Thank you, Art. So I see that I'm going to go ahead and ask my question and then entertain other questions. So I wanted to, initially, I had a question. I wasn't really 100% sure. I know that you provide emergency shelter, but I was wondering, how do you get your participants? Are they referred to you? Are they all walk-in? Like, where do they, how do you get your clientele or your client base?
Is this question for the CSS program and our mental health clients, or Schwartz, the assessment? Yeah,
both.
Because we get our clients different ways. So for Schwartz, we get our referrals from 30th Street.
Okay.
So yeah, like Janae mentioned, Schwartz is only an assessment shelter. So that's not an official shelter. It's a place where clients get assessed, and then eventually, based off their assessment, they get transferred to their official shelter. Now CSS, however, is an official shelter, you know, for adults with serious mental illness. So the way we get our clients, you know, our clients are screened. We partner with NYU Langone Health right across. There's a building here. We have psychiatrists that meet with clients that's a part of the assessment. You know, they go meet with the social service team. They complete a psych evaluation, you know, based off the psychiatrist's recommendation, you know, they'll be transferred to either mental health. So if we see, you know, if we get these psych evals and we see that clients are coming into Schwartz that have serious mental illness, I would then step in and I'll screen those clients and see if they're a good fit for the program. You know, technically, I'm looking for clients that are, you know, connected to services, are engaged, you know, but we don't deny any clients at all, you know, but that would be the perfect, you know, client, someone that, you know, comes in, they have the serious mental illness, but again, you know, they're engaged in services, they're connected. Why? Because again, they're most likely easier to get placed, you know, we're easier to work with.
So I guess a question to both of you is, I guess I could try to answer this, assume it, I don't want to assume it, but do you work a lot with folks who are coming home from incarceration?
Yes.
Yeah, is that
yes.
Yes. Is that the reason you mentioned probation and parole?
Yes, actually.
Can you say a little bit more about what you was hoping to get from a contact there?
Really more so with our sex offenders. We recently noticed a large amount that we had. However, again, with placements for these individuals, because they have certain restrictions and areas that they are supposed to go. So we just wanted, if there were any updates, anything additional that, you know, we can support resources. These clients with. Yes, definitely.
Thank you. Yes, and right before you said probation and parole, there was another demographic of network you mentioned would be good to be plugged in with?
Yeah, health in hospitals, and also, any, right now with the CSS program, we do have one client who is an immigrant, so again, it's difficult because they don't qualify for, for certain services. Yeah, so then, these clients tend to stay in shelter longer, because they can't get that case, or they can't get that public assistance case that's going to help them, pay for housing, or, so there we try to reach out to get as much resources as we can to how can we best service the client. We don't want to leave any clients behind, or have them feel like, they're not being helped. We want to show that we're trying our best.
No, that's amazing. Glad to hear that. I won't take up too much more time with questions. I will entertain some questions from the community board members. Are there any board members who have a question for VOA? I see no hands in the chat. I'm going to assume no questions. Are there any community board members who have any questions? I saw that I see one question in the chat from Janice Holt. Does VOA work with seniors?
VOA, yes, does work with seniors. Again, there's different, our programs are just for single adults, but VOA in Greater New York in general, in New York, we have several different populations. We have senior housings, we have SROs, we have family shelter residences, domestic violence.
Veterans,
say it to your question.
Housing.
Yeah, right. Yeah.
Okay. Thank you very, very much. Are there any other questions? No other questions. Okay, so I just want to thank you guys again for coming through and for giving us your update. We definitely appreciate you, and we appreciate
Thank you for having us.
I'm gonna be on that mute button. Let me. I'm watching you. Yeah, I wanted to just thank you for the work that you're doing, but also specifically for the fact that you are looking for particular contacts that can help build the capacity of clients, and knowing that you may not have all of the services and you need to connect with more people or more agencies that you can refer people to. So thank you for taking that extra step and care to make sure folks are getting the support that they need. I know personally, I've personally experienced homelessness, so I can attest to how important it is to be able to get connected to those resources that you need. So I appreciate you both for this. Copy. All right, so I'm going to transition us to the next part of our meeting, which is old business. So some old business, I'm gonna give the short version of this old business. So we have a 12-month extension on a moratorium that we requested. I don't want to get too deep into the moratorium. What I will say is that what came out of that was an assessment tool that was created by this committee to assess the organizations providing human services in East Harlem so that we could get a better understanding of that organization, the impact that they were having. And this was because we are interested in vetting, and we want to know who's in our community, who's providing services, who, I won't use the term good providers or bad providers, but what providers are doing a stellar job and what providers need to be encouraged to do a better job at what they're doing already, and what providers need to go because they're just like bad for East Harlem. So it is important that we do this assessment. So one of the first things on my agenda with this committee as the new committee chair is to enhance our pre-existing assessment tool. And that is an organizational questionnaire that we have. It was sent around to everyone along with your agenda. I would love it if everyone looked through it. I'm sure some of you are familiar with it because you might have helped put it together or you've come across it in the past. But one of the things that I wanted to do specifically with this committee. I want us to together, identify organizations which need to be assessed. We need to update the contact information for a lot of the organizations that we do have. And we need to identify what organizations need to be assessed. There are a lot of organizations that are on our radar, but there are some organizations that are not on our radar. And we want to know who's out there and what services are being provided, not just so that they can come before and give accountability, but also so that organizations like VOA have more contacts and more referral opportunities in East Harlem, right? To be able to say, hey, we know, there's this very small health organization over here that no one knew about that has a service perfect for a particular client. It's important that this committee knows about that so that we can help VOA refer people to that organization, right? So it is important that we do this assessment so that we know who's in East Harlem and what's happening, who's doing what, right? So I will say, with respect to identifying organizations which need to be assessed to date, thank you, Marlene, for providing us this information. There has been 6 organizations who presented to the Human Services Committee. I'll name them. The Help USA, Shelton Loft, the Center for Comprehensive Health Practice, so CCHP, Odyssey House, Mount Sinai, and Volunteers of America, who was with us today. So we're very grateful for these organizations who have come before us and who have talked with us, but we need to get to more organizations in East Harlem. And I want to take this opportunity to say that this is the responsibility of this community board, right? And whatever we don't do doesn't get done, right? And it's important that we, if we're going to advocate correctly for quality health services for East Harlem, that we, take the initiative to, take the steps to get the information that we need to get in order to, correctly, assess what's happening in East Harlem. So I'm trying to use the most cordial words as possible. Not like, hey, this is our job, let's get it done. I don't want to say stuff like that, right? But at the end of the day, it is. I want to entertain Xavier, our chair. What's going on, Xavier?
Getting through dinner with the kiddos is what's going on. And well, doing a great job, brilliant. Not going to lose sleep, which makes me happy. I want to say, and sorry, because I'm just currently helping with the little one finishing up eating his meal. Into this matter, the genesis of this conversation, and to remind everyone here who's members of the public, are finding out those participants, those people involved who are truly holistic caregivers, if you will. They want to participate, be involved. They are contributing and servicing majority community members, and that's part of why we are dealing with this engagement. And so that's very important for us to consider, and especially since a letter, if it hasn't gone out, is going out shortly, that deals with the statistics that we have. I think it's about 12% of all facilities servicing those with addiction. And we are not anywhere near at some semblance of parity. I mean, the disproportionate burden placed on our community to provide those services has placed us on our back foot. And I think part of this is to realize who are the people who really care. And that's the point of this. It's not an exercise, so we can assess all the data and then take a position and advocate going forward. So just again, reminding everyone, this is not taking a punitive stance, it's not taking a retaliatory stance. It's more about how do we assess and go forward in a productive, holistic manner that is engaging true partnership. That's it. So leave it with you. Brilliant job. Keep it up. Can't wait to see everyone in person, and continue to be safe out there, because COVID, I've got so many friends and colleagues who've come down. So thank you.
Thank you, Xavier, for saying all that. I don't even have to say anything else on that matter. I appreciate you saying that. Yes, exactly what he said. Exactly what he said. This is very important. Also, with identifying the organizations which need to be assessed, we want to review and update the assessment questions specifically, particularly just as a person who has experience with research. I would love it if we didn't have a rubber stamped sort of questionnaire for organizations, but that we had an organization that took into, we had an assessment and a questionnaire that took into account East Harlem specifically and asked some questions that were tailored to the types of services and the types of need that East Harlem residents have, right? So just taking the time, I would love for us to sit and take the time to go through the questions on our assessment and ensure that this is going to yield us the information that we want, not just having, oh, this is a good long annoying survey for people to fill out. And it's like, okay, we got some information, but half of this we don't need. I don't want to send folks 5-page survey when we could do a 2-page one that gets us more information than we need, right? So we want to also just be mindful of folks doing the work, right? We don't want to be hassling them to the point that Xavier just made. We want to know what's going on. So I want us to take the time to update those questions specifically and make sure they're yielding the results and the answers that we want. And also, we have to strategize on our public outreach. It's really not, it can't be on Marlene to reach out to everybody in the community, right? That's not fair to Marlene, and I'm definitely not going to do that as a new chair. I definitely want to sort of push that back to this committee and getting this done and really starting to assign tasks. I'm getting ahead of myself a little bit, but just creating a workflow for this committee that works, and that also keeps us accountable to the community. We're not just here, we're supposed to be here on behalf of the community. And there's a lot of folks in East Harlem who don't know what's happening right now at this community board meeting. They don't even know that it's happening. They don't even know that there's a possibility that we may vote on something that may impact their life for the rest of their life. That's not a good thing, right? So it's important that we can increase the engagement, right, in a lot of ways. But first, we want to increase the engagement and the level of effort right here with this Human Services Committee. We have, I believe, one of the biggest responsibilities as a committee in CB11, the Health and Human Services. Human Services is so wide and so vast, right? It makes up so many different care and quality needs for folks. So it's important that we take this very serious. So this is going to be my push to my fellow committee members, in that we need to get this work done. We need to do this assessment, and we need to see what's going on in East Harlem so that we can move accordingly, so that we can report accordingly, so that we're not, just reporting on what we believe is happening, but what we know is happening because we did the research and the assessments, and we talked to people and we found out, right? And we put our boots to the ground. So I will, any questions, thoughts from anybody? Questions, thoughts, committee members, please chime in. Robin, please.
Hi, Isaac. I'm actually relieved to know that there is a category of community organizations that you're looking at. I wasn't sure that you meant we have to think about every service provider in East Harlem, but you're really focusing on who is contributing to the traffic on 100. This really goes back to that, isn't it? To what's going on 125th Street, and how is East Harlem caring for so many people in need of services, and where are they all coming from, and how they are all getting licensed, and why is it ending up in East Harlem? Because it's geographically convenient, it's transportation convenient. So I have a couple ideas, which I'm happy to talk to you about offline rather than taking everybody's time.
Well, thank you.
Because I think we have the keys to it, and it could be done. But I understand the reason for the tool, because you really have, at the end of the day, it's talking about apples to apples, right?
Yeah, thank you for that, Robin. Yes, we can definitely cite that location as a focal point. And I honestly, I'll be very transparent with you all. I see this committee and the human services period as the prevention that we need in order to see the public safety that we're looking for. I think that, we're going, we're trying to pursue, safety and health and quality of life for people in a lot of ways that come across as, a little bit too punitive and not as supportive as they need to be. And I believe that quality human services would really get us to a point where we didn't see a lot of what we saw, and folks were able to get what they needed, and we're able, and it's not just having the service, it's not just that, it's also being able to maintain the lifestyle of being, of being able to exist with whatever issue that you have. So there's a lot more than just getting services. How are we helping people sustain themselves and maintain themselves? And that's not our job, but we are in some ways watchdogs for the organizations in East Harlem that are doing that. So in a lot of ways, to that point, we do need to know what it is we're looking for. What's our vision for East Harlem? And I think that right there is a good sort of segue into what I was hoping to cover in this last part of this meeting. I really wanted to just take this opportunity, since it's my first meeting here, I wanted to take the opportunity to hear from the other committee members, a little bit about themselves and hopefully a little bit about what your vision is for this committee. What do you hope that we accomplish? Without a vision, we would perish in this work. So it's important that we have a vision, and I just want to know what everyone's vision is, because we all come to this work from different backgrounds, right? The issues that Robin may be very, very knowledgeable in are not the same issues I'm knowledgeable in, right? And that may serve different ways. So it's important that we all sort of know where folks is at and what issues people are adamant about, because in those ways we know what committee members we can lean to when there's a presentation or information comes before the board, and all of us may not be as knowledgeable, but a few people may know something about this and can help lead us in directions and in voting and in just getting perspective. So I wanted to take this opportunity to just go. It's not too many committee members today, so this shouldn't take too long. It's only about 4 or 5 of us, but I was really just hoping that you could just, say your name, your connection to East Harlem, why specifically did you choose to serve on the Human Services Committee, and what you would personally like to see this committee accomplish. I'll in the spirit of going first and opening up and being vulnerable first, I'll be very transparent with you all. I joined the Human Services Committee because I felt specifically that, this was the committee that cared most about the human being. I really, that's, and it may sound real tacky and like, oh, that's it. No, it wasn't that. It was like, this is the one that really is, it cares about, how people are treated, how they, the services they get, the mental health issues, what backgrounds people have and how they may, not be able to navigate things that other folks are able to navigate. So the Human Services Committee really stood out to me as that committee where I felt like, I could have the most impact. A lot of the work that I do is in criminal justice reform, and that comes specifically out of my own experience with incarceration. I grew up in West Harlem on the Upper West Side, and as a young person, I got into a lot of trouble. I went to school and got into a lot of trouble, went to school and got into a lot of trouble, and ended up going to jail for a long time, and came home. And since I've been home, I've been able to go to Columbia University. I've been able to work there, build my skills as an artist, get the professional development help I needed, social support help I needed, and all of those things. So I can speak, I know I may have the pastor in front and it may seem something, but I got a story, and that story comes a lot from needing human services, you know, and I can trace a lot back to, you know, if I would have had a human service here, I would have been all right. If I would have had some social support here, you know, if I would have had some mental health counseling here, you know, some family support counseling here, you know, and different support mechanisms that are set up right now. You know, union settlement came last month, and I'm going to get them to come back, but they spoke about a mental health program initiative that they have now that speaks to, that provides that service to young people and their families. You know, just thinking about that, if I had something like that, how would that have changed my trajectory in life? You know, so a lot of what drew me to here is really being able to pay it forward, and just understanding how important social services are for people and how much it can change the trajectory of a person's life, you know? So that's another reason why a lot of times y'all hear me not allow folks to, you know, badmouth people who are not showing up correctly today, because I do understand that, you know, folks have a story, and if we allow folks the opportunity and get them the support they need, chances are they will show up in our community totally different than how they're showing up now. So that's important, right? So that's why I chose human services. My connection to East Harlem is I've lived in East Harlem for about 5 years now, born and raised in Harlem. I'm also a community pastor now, working at Mount Zion AME Church on 116th Street in Madison, serving under Reverend Khalil James, great man. This man has really allowed me to work in the area that I'm comfortable in, and that is in this area right here. And you know, and I'm very grateful for that. So this is the work we're doing right on 116th in Madison. So that's my connection to East Harlem. I don't expect anyone to talk as long as I did either. Forgive me, y'all see that I'm a little long-winded, but I want to be transparent. So today I'm gonna, in all transparency, be a little long-winded, so you know who's going to be, you know, leading this committee and this work moving forward, right? And what I hope to accomplish personally with this committee is that there's a holistic understanding of health and human services, you know, that we can begin to advocate holistically for services, and that we don't, you know, that we move away from the attitude that certain people don't belong and that we don't want certain people, but that how do we ensure that everyone here is provided with the best quality services to ensure that, you know, East Harlem is safe, and East Harlem is not the dumping ground for every other community who want to, you know, clean up theirs, so they throw everything over here to us. So, you know, that's something I hope to accomplish on this committee, and I will work tirelessly towards that to ensure that we are doing our best as a committee. So that's my long introduction to everyone. Thank you for hearing me. I want to, I'll pass it to my vice chair, if that's okay with you, Art. If everyone could just take like 2 minutes, you know, just your name, why you joined Human Services, and what you hope we accomplish. That would be really helpful, just so that everyone here is on the same page with who's serving on this committee.
All right, thanks, Pastor. Okay, my name is Art Perez. I've been on the committee, I guess about 1.5 years. I work in East Harlem. I live in East Harlem. I mean, that's my main connection. I chose to serve on Human Services because I work in Human Services. I'm the CEO of the East Harlem Council for Human Services here in East Harlem, 3rd Avenue, between 123rd, 124th. Puerto Rican Neighborhood Health Center. We provide primary care services, behavioral health services, dental services, social services to East Harlem residents since 1974. And I'm very happy and proud to be part of that organization. And what I would like to see accomplished here is essentially to make a difference, to really push through the agenda for East Harlem, to advocate for East Harlem. I'm also on the budget committee, because I think it's important that, you know, we get what we want from the city council and the mayor. and that we do something and that we engage to make a difference. And okay, so
Thank
that's
you
it for
very,
me.
very much, Art. I appreciate that. Thank you for your service. Can I pass it to the next committee member? Maybe Pat Martin, is that okay?
I'm sorry. Hello, my name is Pat Martin,
Hi, Pat.
and hi. I live here in East Harlem, and I founded organization Harlem Yes, and we do community-based events for the LGBTQ community, allies, and friends. My concern with East Harlem is that there's so much going on here, and we have to be aware of our community. We have to be involved in our community in order for this community to grow and to build and to be united. So human services deals with human beings. It deals with the needs of the humans that make up a community. And that's where I want to be. I want to be involved in what makes our community grow. Thank you.
Thank you, Pat. I appreciate you. And thank you for your service too.
Thank you.
So can I ask the next committee, Robin, can I call in?
Hi, you said Robin Quincy?
Yes.
Hi, because I know there's two Robins.
Oh, yes,
So,
I'm sorry. Yes.
It's okay. So my name is Robin Quincy. My connection to this community board is that I worked at Mount Sinai Hospital. I don't live in this community, but I've worked here for over 25 years. And I know this community far longer because my children went to school in this community. I'm a nurse at Mount Sinai, so the draw to this committee was only natural to ask to be on this committee. And I guess why I want to be here is that I presented to this committee many years ago and to the whole board. And I was just so taken with the dedication of so many people have in this community towards making it a better place, trying to decrease the disparities among people, that I really wanted to join and see if I can help and make a difference. The disparities are enormous. I tend to see patients from this community who have been marginalized by not just the government, but within their own families. And these outcomes really are like social determinants of their health. I see a lot of people in this community with asthma, with high blood pressure, with diabetes, with tremendous amounts of heart disease. And there are so many services that are available that people do not take advantage of, don't even know that we need to bring this out more to everyone. I know there are people that feel too proud to take some of the services that are offered here, but there's such an abundance and it's such a rich group of people that it's a pleasure, and I'm proud and humbled by serving on this committee. And whatever expertise or whatever help anyone needs, I'm available. So that's my draw to this. Thank you.
Thank you so much. Thank you so much. Thank you for your service, and thank you for that. I appreciate that. I think that was everyone. Am I correct, Marlene? Did I forget anybody? I think that was it. Okay.
You forgot Robinstration.
Oh, no, I didn't. No, I didn't. I was saving the best for last. Come on, Robin.
Well, maybe you did, because I'm actually the public member of this committee, and I have been for at least 10 years. And how it started was I made a presentation at a full board meeting about a new service my nonprofit was beginning to offer so that people with pets, their pets could age alongside of them. And it's so interesting because we often say that pets, have no voice of their own. That's why they're so vulnerable. That's why we look out for them. But I think seniors are the same. They become kind of voiceless and unseen. And it's not a matter of rights. It's a matter of how do you protect one of our community's resources. And that's what we try to do. But the reason I joined this particular community board is I live on the cusp of Community Board 8 and 11. And I'd been to Community Board 8 meetings where they were talking about, oh, isn't it terrible? The buses take up so many parking spots. Oh, gee, the dog run needs, some money thrown at it. And the first meeting I came to at CB11, we were talking about how did this happen? A liquor store opened up within X blocks of the school. How could this have happened in our community? And I just felt the pride and the activism, and it's so attractive. And I wanted some of that. So I stayed. That's about it for me.
Okay.
Yeah.
I got a little bit of that too when I first came. I was like, okay, I like this board. No, that's great. I appreciate everyone. Thank you all. And I'm definitely going to ask folks who aren't on today to just breathe into this space for us so that we know who's in the room. And it's that right there helped me out to know who's in the room. So I'm certainly very, very thrilled and happy to get to work with everybody. I wanted to just briefly go through some special requests that I have, and then we can transition ourselves out of here for the evening. So as we consider the quality of human services provided, we must consider the quality of our meeting etiquette, especially for people who join for the first time. So this is something that's important to me. Understanding is a human service and mindfulness is a human service. So how we conduct our meetings, we've been on some, I'll say, I don't know if all of us have, but there have been some hectic meetings, in the past. And, I'm definitely not going to keep us away from any tough topics, and we will hash it out here. But I'm just asking that we always do that with respect, right? And let's be mindful of the language that we are using. Language can be dehumanizing. It's very important that we use people first language, not just, a crack addict, a person who's dealing with substance abuse, so just being mindful of how we're articulating people. If this is the Human Services Committee, let's acknowledge the humanity of everyone, right? So to the best of our ability, if we could just be mindful of the language we're using when we are talking about a particular group of people, because we never know who else is on the call, right? We may be talking about a group of people, about a service that a particular group of people receive, and someone is on the line who receives that, and they're not comfortable with how they're being, addressed or identified. So this is important. So I definitely want to call us on that. Also, let's be understanding that there are many different experiences and backgrounds in the room. New perspective is always insightful, and listening is the cheapest concession that we can give. So it's a lot of us in here. We come from different places. We have different expertise. All of our knowledge is valuable. So it's important that we listen intently to everyone in this room, and we honor each other's perspectives. We can agree to disagree, right? That's the great thing. We can always agree to disagree, and then maybe we can agree on some things as well, right? But one of the things I'm just very hopeful for is that this committee will move as one unit that works together, and that we have a unified goal, and that is to acknowledge the humanity of every person, even those people in our meeting space. So, and also not acting like, we're talking above people, like those people and stuff like that, things like that. Let's just be mindful. And lastly, before I let you guys go home, this is for committee members. As far as the workflow relevant to some of what I just mentioned, starting with our assessment, which will be the first item that we take on, or first task that we take on under this new leadership. I will let you know that I will solicit volunteers. So I'm going to email the committee members with some things that we need done. And I'll ask you, hey, do you think you can help in these areas? And then there will be times where I will assign a task for the committee where we're just going back, getting some information and coming back to the board the next month with that information, or whatever that task may be. It won't be nothing crazy, because we all got, 9 to 5s, and I want to respect everyone's, workload, but there are some things that this committee needs to get done, and I can't do it all by myself, and we can't ask Marlene to do it either all by herself. So it's important that just as, committee members that we, just dedicate just dedicate some time to getting this assessment done. That is all that I have for everyone this evening. I see there is a raised hand. Is there a raised hand? I thought I saw a raised hand.
Yes,
Okay.
it's in the attendee section.
Yes, can I entertain that raised hand?
Sure.
Yes, can we?
Hello, hi. Yeah, my name is Manish Kamans. I just want to introduce myself and my organization really quickly, if that's permissible, Chair.
That is fine. Go for it.
So my name is Manish Kamans. I've been kind of been with the community board since the beginning of the year, just talking about my organization a little bit. And given that it's changed a little bit now that new members are in, I just kind of want to reintroduce myself, kind of let you know about the resources we provide. I founded an organization called SELA. It's a research center that studies public sentences. We treat them as objects, and we look at the properties that they have, and then we're trying to encourage civic institutions, community organizations to sort of approach their political or public language in this sort of way. And we think that thinking about the kinds of properties a sentence has that you use to talk about your civil experience can actually really make advocacy and change really effective. And I'll post my information in the chat, but you can kind of see what we're doing. And we're really looking forward to be a resource for your committee, and more importantly, the community board, to sort of help ensure that we're really trying to advocate for marginalized communities, and we feel as if the language is kind of being neglected to their detriment. And so we want to kind of introduce you to this idea of thinking about your sentences in this way, and making your advocacy on behalf of marginalized community members just a little more weighty. And so it's going to be it's a little technical, but we're really excited to sort of partner with everybody here, kind of talk what we're doing, particularly in person, and kind of see how this goes the next coming year. So you'll be seeing me, I'll be sending stuff, and yeah, just look out for it. Appreciate the opportunity to say what I have to say.
No problem. You presented at full board a few weeks ago, huh?
I made a comment. I didn't present, but I made like a comment.
Okay,
yeah.
I think I remember looking up the link that you put in chat. Thank you. Please put your information back in, and I actually did want to follow up with you about some of that. So thank you very much for just reiterating that information. Okay, are there, and before we do the roll call, is there any board members, any information, any announcements, any final words, any questions, comments that any board members want to sort of leave out here, ask any questions? I'll also open that up to the community members. Are there any last thoughts, words, questions, comments before we head out? Okay, seeing that there is none. Okay, can we shout out Isaac for making it through his first community board meeting as a chair?
Congratulations.
Well done. Well done.
I appreciate you all.
You make it look easy.
Thank you. I'm sweating over here though. Okay. Marlene, can we do the roll call?
Yes. Eva Chan. Oh, Eva Chan is out today. Osendi Garcia. Robin Krinsky.
Present.
Thanks. Patricia Martin,
Present.
thank you. Jennifer Myers excused. Shirley Pena. Arturo Perez,
Present.
Pastor Isaac Scott,
I am present.
and Robin Stration.
I am present.
Thank you.
So thank you all very, very much for being here and for bearing through this. I will be in touch with next steps. And when is full board meeting?
The 24th.
The 24th. Full board meeting is on the 24th, and we look forward to seeing you all there. So do I have to say like this meeting is adjourned, Marlene?
Yes, you don't have to get a motion.
Okay, so this meeting is officially adjourned. Boom. All right, y'all have a blessed evening. I'll see everyone soon.
Okay, good night.
Okay.